Hello, welcome back to this channel. In the next few minutes, we are going to look at the treatment of thyroid nodules. In this channel, we talk about the basic medical information making a big difference. Information is power, and when we are equipped with the right information, we'll get to make the right decision. I am Rebecca Morangi, and this is the best place to be. We have been looking at the thyroid gland, and we have done few videos in small subsections. Now, today, we are going to look at how are the thyroid nodules managed or treated. In the last video, we looked at the thyroid nodules, the classifications, and the causes. For the diagnosis of thyroid nodules, one of the ways to diagnose is through what we call a thyroid ultrasound. We said this is where high frequency waves are used to show the shape, even the structure of the thyroid nodule. Now, before you get to treat this, the first thing the doctor looks at is to know the type of the nodule. What happens when somebody has a benign nodules? On how do you come to know that it's benign? We mentioned again on the ultrasound, there is what we call fine needle aspiration, where with the use of, all guided by the ultrasound, a special needle is injected into the nodule in your thyroid to remove the aspiration, all the cells from the nodule, which will be taken to the lab for cytology. Now, in the lab, after doing the tests, they classify, all the classifications are done into 6 groups. Now, this is where we call them, or they are used, or they are grouped by what we call the Bethesda system. Category 1 is what we call non-diagnostic. This is where maybe there is no enough sample, or a sample which was removed was not enough to give the final result. And in this case, they can decide to repeat the fine needle aspiration again. Category 2 is what we call benign. Category 3, it's what we call follicular neoplasm. Another category 4 is what we call suspicious for malignancy. And then you have another category called atypia of undetermined significance. And then the last group is what we call malignant. Now, after this grouping has been done, the doctor will use different treatment ways. Now, what if the nodule came out as benign? One thing the doctor will do, he or she can decide to do what we call watchful waiting. Watchful waiting here is to keep on monitoring the nodule through physical exams by checking whether the nodule is growing larger and bigger in size. Again, by doing thyroid function tests. Also, he can or she can decide to do ultrasound. Now, here, the doctor will monitor the progress of the nodule. Now, There is another way a doctor can use to manage a benign nodule by the use of what you call thyroid hormone therapy. If the thyroid is not producing, that is when the thyroid is now not producing any amount of thyroid hormone, you'll be given thyroid hormone therapy to enable you to produce the thyroid hormone which are needed for your body to function normally. Another way of managing or treating a benign thyroid nodule is through surgery. Surgery here is when the thyroid is removed, either the entire thyroid, what we call total thyroidectomy, or parts of the thyroid gland. And here, when somebody has what we call multinodular goiters, or a large number of nodules, this is when the doctor offers to use this treatment option for benign nodules. Now, what if the nodule is producing what we call hyperthyroidism symptoms? And here you remember how we classified or we defined hyperthyroidism. This is when your thyroid gland is producing more amount of thyroid hormones. Now, when you present with hyperthyroidism symptoms because of the thyroid nodules in the thyroid gland, these symptoms, remember we mentioned as maybe you have tremors in your hands, sometimes what we call irregular heartbeat or pulse. Others present with symptoms of anxiety or irritability. Now here, the doctor can decide again to do what we call surgery, of which you have mentioned about, and then all use what we call radioactive iodine therapy, where you are given a small liquid or a capsule of radioactive iodine, which will shrink the nodule in your thyroid to reduce the hyperthyroidism symptoms. Or the doctor can use antithyroid therapy or medication. This is where you are given the medications, an example of papimazole or methimazole, to reduce the hyperthyroidism symptoms, of which sometimes has long-term side effects by affecting the liver. So you will be monitored. All regular tests are sometimes done to see how your liver is. So that is one way of managing a nodule which is presenting with hyperthyroidism symptoms, and again which is benign, and nodule which is benign. Now, what if the nodule is malignant or it's cancerous? Treatment options. One is what we call observation. Here is where now the thyroid specialist decides to observe the nodule, because sometimes small or small cancers, they don't grow aggressively. So he can decide to watch the cancerous nodule before he decides to, or she decides to treat it. Now, what happens in this process of observation? Here, the tests are done, thyroid function tests, where they test your TSH levels and the two thyroid hormones, that is T3 and T4. Again, the doctor can decide again to do ultrasound at different intervals to enable him now to do the final, maybe to decide on how to go about it. So that is what happens on the observation option. Another treatment option here is what we call surgery. Surgery here is the removal again of part of the thyroid gland, or a whole of the thyroid gland. Now, here, what can be the side effects after this treatment? One, the nerve which control your vocal cords can be damaged. That is one of the risks. All the parathyroid glands can be damaged. What are the parathyroid glands? These are 4 tiny glands back at your thyroid gland, which controls the level of minerals in your body, especially calcium. So if they are damaged, one will have to live on lifelong medication of what we call calcium to regulate the amount of calcium level in your body. Again, in total thyroidectomy, again, somebody has to live on levothyroxine medication to enable your body to produce the thyroid hormones needed for your body to function normally. So those are the side effects or the risks which comes alongside with the treatment options of surgery, what we call total thyroidectomy. And again, third treatment option on a malignant nodule is what we call alcohol ablation. This is where a small amount of alcohol is injected into the nodule to destroy the nodule. And here, multiple treatments of this alcohol is done at different intervals. So those are the treatment options available for a malignant nodule. Up to this level, I believe you have gotten some information on how the thyroid nodules are treated or managed. Remember, actually, 95% of the population, 95% of the thyroid nodules, they turn out to be benign. Only 5% turn out to be malignant. And also, almost 50% of the population has got thyroid nodules. Some of them, they don't even know because they don't present with any symptoms. Their life is normal because nobody actually decides to wake up to go to the hospital to be checked whether he or she has the thyroid nodules. Because we said these nodules are discovered during the routine treatments or the routine medical examination. There are those who can go to the hospital to be done maybe a chest x-ray due to maybe there's a certain condition the doctor is trying to check out. Now that is when these nodules are discovered, or when there is something needed to be done, maybe an ultrasound for the neck. That is when the thyroid nodules are discovered. That is why we are saying nobody will wake up one day and go to the hospital to be checked. These nodules sometimes are discovered in routine examinations or when a certain medical condition is managed or diagnosed. So up to this level, I believe you have gotten the ways of treating the thyroid nodule. One, the benign nodule or a malignant nodule. And the benign, you have mentioned on watchful waiting or thyroid hormone therapy and surgery. And a benign nodule, which is producing hyperthyroidism symptoms, can be managed again by antithyroid hormone therapy, radioactive iodine therapy, all by surgery. Again, on the malignant nodule, we have looked at observation, surgery, and alcohol ablation. Thank you so much for always coming back to check on this channel. Kindly consider to subscribe. Hit the notification bell so that you'll be the first one to be notified when I upload a new video. Thank you so much. Let's meet in the next video. Bye bye.